So I'm just going to tell you a little story about my experience before my mom passed away and thinking about putting my mom on hospice. And it's kind of a crazy story in that the social worker at a place where my mom was staying at, it was a skilled nursing, basically told me, yeah, if you go on hospice, your mom can't be on any medical anything. Meaning that at that time my mom was on a ventilator and my mom had a stomach feeding. And so basically she told me to go on hospice, your mom would have to basically get rid of the ventilator and get rid of the stomach feeding. And which I said, so we're going to put her on hospice so we can watch her die in 3 days? Well, that's kind of how it is. And that was one of my very first experiences with hospice. And the sad part is most people don't know, and many times, even sometimes medical professionals may not exactly know unless you've talked to a hospice person what hospice is and what hospice is not. Hospice, I have found in the 16 years doing this, is a wonderful program. And so I want to go over some myths about hospice and hopefully give you a little more information than I had when having to deal with some very hard choices to make, especially under obviously an emotional duress because it's the potential death of a loved one. I'm Phil Natsiopoulos and I own Always Best Care Senior Services. Hospice is specialized care that focuses on comfort, dignity, and quality of life for people facing a terminal illness when the goal is no longer to cure, but to live as well as possible for as long as possible. So your medical directive and oversight is no longer curative, it's focused on comfort and quality of life. And that's a really important place to start. It was actually described to me very well by a hospice person, basically saying, look, there comes a point in time where, let's just say typically 6 months out or less, there's a finish line. And you can walk to that finish line in two different courses. You can go the course of trying everything you can to get better, but you're going to still hit the finish line at the same time if you took the course that wasn't focusing on trying to do everything you can to get better, but trying to do everything you can to have comfort and quality of life. And if you approach it that way, it makes a lot of sense. And I have seen enough cases professionally where hospice just is so helpful. It's also important to understand the things that hospice does do and the things that they don't do, because there's a lot of misunderstanding around that. So I'm going to go over some myths or some misnomers about what hospice is and what hospice isn't. Myth number one, hospice means giving up. The truth of the matter is hospice is not about giving up. It's about choosing comfort and quality of life when a cure is no longer likely. Myth number two, hospice is only for the last few days of life. And in my story, it sounded like they were going to create the last few days of my mom's life. But the truth is, patients can receive hospice care for 6 months or longer if their condition qualifies. Myth number three is, well, hospice is only for people with cancer. And the truth is, yes, there are a lot of people who have cancer who are on hospice. But depending on the situation your loved one is in, if they're still facing a situation where the end is looking clearer that there's going to be one, hospice can be for any situation. The one that I had mentioned earlier, number four, hospice means you have to stop all medical treatment. And that was unfortunately what a social worker thought what hospice was. And so then I thought that's what hospice was. And I'm like, well, we're not doing that. The truth of the matter is hospice will stop medical treatment that's curative. In other words, we're saying that we're no longer trying to cure the medical condition that's put us in this place. But if there are other things that are needed medically to help sustain a person, like in my mother's case, it was having a ventilator, it was wound care, it was having a feeding tube for a stomach, things that are like that. If someone's a diabetic, those things will continue. Myth number five, hospice is a place where you go. There are places called hospice houses, so there can be that option, but hospice is portable. Hospice can be done in a hospital, in a skilled nursing, in an assisted living, adult family home. Hospice can be done in your own home with the idea of comfort and quality of life. Myth number 6, hospice is expensive. And nothing could be further than the truth. Hospice is something that is clearly covered by health insurance. Definitely covered by Medicare and any other insurances that are out there. So it's one of the wonderful things when being with a client and trying to help them navigate through this. Look, not only are they going to be there, they're going to take care of all the stuff that you need, especially if it's at home. You might need a hospital bed and all the other things that are going to be necessary for that person's care. They will show up like overnight and just have things ready to go if mom or dad or whoever your loved one is coming back home to spend the rest of their time there. Myth number 7, families won't receive support. And I'm just going to read this one because it's important. Hospice supports the entire family, offering caregiver guidance, respite care, grief counseling before and after the patient passes. One of the more important elements of hospice is there is this amazing level of support that's not just for the patient, but for the family. Myth number 8, you can't leave hospice once you enroll. And actually there is something called graduation. There are people who do graduate from hospice. The idea being that it looks like from a medical perspective there's 6 months or less to live, and then all of a sudden we're still around and maybe even thriving, and the next thing you know, hospice is no longer there because it wasn't time. And same thing in reverse. If later on down the line it looks like we're kind of at that point again, then hospice can come right back in and be helpful again. Myth number 9, hospice hastens death. Actually, the truth is, studies have shown that some patients live longer on hospice than those who don't. Myth number 10, all hospice providers are the same. And that's very important to know that that's not the case. It's been interesting out here in Washington State. For the longest time in our area, there was only like 2 providers. And now, to my knowledge, I can think of at least 5 or 6. All of them are a little bit different. Some are nonprofit, some are for-profit. So it is important to get educated. And if you're not sure where to start, there are people like me out there that you can reach out to and say, hey, do you know anything about this or that? And more than happy to talk about it and kind of really understand what your choices are. Also, if your loved one's in a hospital, in a skilled nursing, and they are going to discharge, lean heavily on your social worker. They really do care and they really do know what they're talking about. Myth number 11, and this is kind of a really important one, and this is the one that we deal with a lot. Hospice covers all of your loved one's care needs. And unfortunately, that is not the case. So a lot of times when we get a referral, I'll have someone say, oh, well, we have hospice, we don't need you. It's much like the video on home health versus home care where, oh, we have home health, we don't need you. Unfortunately, hospice does not do a full coverage of care needs 24/7. What will happen is this: you'll have a nurse usually 2 or 3 times a week. You'll have a shower aide usually 2 times a week. And then you'll have other things like music and different things that they can come in, counseling as you need it. But the day-to-day care, especially if someone is bedbound, where all the things that they need to be clean, dry, comfortable, and safe, that falls on the family. And that's where companies like Always Best Care come in, where we can take the load of the care needs off of your hands and allow you to just be right alongside with your loved one and do the thing that you need to do, which is be that loved one, be that daughter, son, be that husband, that wife, whoever that is in your life, and really focus on that time with them, and also not feel the pressure and need to have this heavy burden of caregiving, because that's what we do, and that's what we do very, very well. Those are a few myths about hospice. I hope this has been enlightening. It's been one of my joys in doing this, of really learning about hospice and how great of a program it is. It's there because, at least in my case, the thing I see most is it takes a very complicated and a very emotional situation and underpins it with support. To learn more about working with us and helping you navigate some of these situations, please go to alwaysbestcaretacoma.com.